All right, in just a week from today, my co-host, Elizabeth Reese, you know her, she's going to be doing something she's never done before. That's have surgery live on television.
I know.
Live on this show.
I've never, I had my wisdom teeth taken out. Does that count as surgery? That's the only surgery I've ever had. No, I didn't do that.
We're talking about live on this show.
This is live on the show. That's right. Yeah. So you're going to see me getting LASIK, and this is the cool part, from start to finish. You're going to watch the whole thing. And, you know, I do have to say, as it's getting closer, I'm getting a little bit nervous. So today, it's time to get all the questions answered. Before I go under the knife, or rather under the laser, I wanted to know exactly what happens before, during, and after the surgery.
Once I get this all in focus, I'll have you hold for the count of 4.
First up, making sure I'm a candidate.
We look carefully at corneal thickness, making sure we have enough tissue to safely remove some to reshape things and still keep your eye healthy the rest of your life. We look at the curvature. We want to make sure that cornea is not too flat or too steep. We take a three-dimensional or topographical map of each eye, making sure the overall shape is normal. This scan really tells the surgeon a lot of information as to whether or not you're a safe candidate to have the surgery.
Okay, so my eyes
look great. They're perfect.
They're ready to go.
You're a great candidate.
Did you hear that? This is very exciting news. On the day of the surgery, I'll follow the laser beam to this room. There are 2 things to help with the nerves, Valium and this guy.
This is the laser gator. So during the surgery, they get to hold the laser gator, give it a little squeeze. It helps them get through the procedure.
The gator and I will lay down on this bed, and this little clamp holds each eye open while Dr. Lobanoff goes to work.
LASIK surgery is a very, very precise surgery. And what is done is a flap is made in the cornea. The cornea is the clear dome of tissue over the front of the eye. A very thin and precise flap is made in that tissue layer. The flap is elevated upwards to expose the middle layer of the cornea. At that point, the laser comes down, removes tissue from the middle layer, reshaping it, and that very precise flap's put back in position.
Patients often wonder what happens if their eye moves during the procedure. North Suburban is the only LASIK center in Minnesota with the fastest tracking system available. If your eye moves, the laser stops.
We know that no matter how fast the eye moves, the tracker's faster. It tracks the eye every 1/1000th of a second.
When Dr. Lobanoff first started performing LASIK nearly a decade ago, it took 2 full minutes for the laser to do its work. Next week, my eyes will be looking at a laser beam for just 20 seconds. And after it's done,
we will swing you out, you will sit up from this bed, and you will immediately be able to see around the room.
That's so cool.
Overnight, after 1 full night's sleep, you'll wake up the next day, the fog or haze will be gone, the eyes will feel back to normal, there'll be no pain or discomfort. The next day, everything will be clear.
It's going to be good.
I think we were all good until we saw the clamp, Dr. Lobanoff.
Everybody worries about the clamp.
I suppose they do.
It's not that bad.
It's just a little pressure, right, Dr. Lobanoff?
That's right, a little mild pressure.
See, isn't he helpful?
Yeah.
I don't even feel that nervous.
We got a lot of questions for you. So we had to sift through some of the questions that our Twin Cities Live viewers sent in, and that's what we're doing here with you today. We've got some questions we're going to throw at you, so we thank you very much for being here.
Happy to be here.
First question, ironically, Lisa from Sleepy Eye.
Sleepy Eye.
Okay. She says that I tried to have LASIK about 5 years ago, but they said I could not because my pupils were too large, my cornea was too thin. Is there a procedure now that covers both these issues?
Ooh, that's a good question.
We can fix sleepy eye. Pupil size used to be a bigger concern because with the older lasers, the treatment zone, what we call the optical zone, where the eye is treated for the light to be focused for distance, was a certain diameter. And at night, the pupil could dilate beyond the edge of that zone. Now, with our new Technoless laser, we have the largest optical zone of any laser in the U.S. market. So we can make an optical zone bigger than the pupil can get at night. So large pupils are no longer a concern.
Okay, that's good to know. And, you know, I asked Dr. Lobanoff the other day if when the Laser Today catalog comes, if he, gets so excited to see the new stuff that comes out.
That was pretty exciting.
I do. We love the new technology.
Yeah, loves the new technology.
You get a free hat with every subscription, too. It's awesome.
Okay, next question is Carol from Luck, Wisconsin has a question. She wants to know, can someone with 20/20 vision but needs drugstore glasses to read get LASIK surgery? This has got to be a big question because I know my mom has about 25 pairs of the reading glasses from Walgreens.
They're usually sprinkled all over the house and through the car. And we get this question all the time. This is probably the most common question we get. And yes, we actually can correct vision so that you can see both near and far. so you can eliminate the need for those reading glasses.
Wow.
So all these people that could see great their whole life until about age 45 and then they're stuck in reading glasses, we can now fix that.
That's amazing.
That's good.
Marion is up next from St. Paul, and Marion asks, can LASIK be done on eyes with astigmatism?
Yes, it can. And this is a misconception that comes about from about 8 or 10 years ago. LASIK could not correct astigmatism. But for the last 6 to 7 years, we've been very successful at treating astigmatism. And now it is not a problem at all. So yes, we can fully treat astigmatism.
Okay, good. Okay, so I have to ask the one question. I did ask you this the other day, and I was kind of embarrassed to ask this question because obviously, you know, he's a reputable doctor. But I said, Dr. Lobanoff, how many people leave here blind? Because I was wondering.
Well, you know, you're getting your eyes worked on.
Yeah, I thought,
it's a
how
reasonable
many people
concern.
walk out of here and they're like, shoot, nope, no more seeing?
Doc?
No one. People do not go blind from LASIK.
Okay.
You know, and it's a common fear because these are your eyes.
Yeah, you have
it's
one
your
set.
eyesight. You have one set. You have to take this very seriously, but we also take this seriously. And it's why we commit ourselves to having the best technology. It's why I committed myself to a year of my life doing a fellowship just in LASIK, so that you have the best training, the best technology to get you the best result.
This guy knows what he's doing.
But nobody goes blind.
Nobody goes
I'm
blind.
glad he takes it seriously, too. Because it'd be awful if you were like, okay.
Yeah,
he's
and you
just
know what I
joking
love
around.
about him,
Like,
too,
oh.
is that a lot of places I've heard that you don't meet your surgeon until the day that you're scheduled to go under. And, I mean, you don't really go under, but, you know, you're scheduled to lay there under the laser. And Dr. Lobanoff meets with every patient.
It's good.
Times before, not just me.
Right.
You feel very comfortable with this guy.
Yeah, I do.
Thank you,
And
Dr.
look how
Lobanoff.
cute he is,
Thanks
I
a lot
told
for
you.
being here. If you have a question for Dr. Lobanoff, he is going to answer it personally. Just head to our live LASIK page on our website to submit your question. And don't forget to watch next Tuesday when Elizabeth gets LASIK surgery live on Twin Cities Live from beginning to end.
I know, my eyes get really big whenever we talk about it. Yeah.
Well, that's because you got to be ready for that clamp thing.
I'm ready.
Hey, coming up, a Greek salad recipe to keep you eating heart and healthy.
Yeah, but first, let's go to Dave Dahl for a look